Will I need an ostomy for diverticulitis perforation? When a perforation happens in diverticulitis, it means a hole has formed in the colon, which can cause infection and contamination in the abdominal cavity. Whether you need an ostomy depends on how severe the perforation is and your overall health. If the perforation is contained, like in an abscess, doctors might treat it with antibiotics and drainage, avoiding surgery and an ostomy. But if the infection spreads widely or causes peritonitis, surgery is usually necessary. Surgical options vary. One common approach is primary resection with anastomosis, where the diseased part of the colon is removed and the healthy ends are sewn back together. Sometimes, a temporary diverting ostomy, like a colostomy or ileostomy, is created to protect the new connection. Recent studies show that doing this with or without a temporary stoma can lead to better outcomes than older methods. In more severe cases, especially if the patient is unstable, surgeons may perform a Hartmann's procedure. This involves removing the diseased segment and creating an end colostomy, leaving the rectal stump closed. This often results in a permanent or temporary ostomy, depending on recovery and future plans. Another option is damage control surgery, which is staged. The initial surgery controls infection and contamination, and later surgeries may restore bowel continuity. This approach can help many patients avoid a permanent ostomy, with some studies showing over half of patients do not end up with a permanent colostomy. The decision to create an ostomy depends on several factors. These include how much infection and contamination there is, the patient's overall health and stability, presence of sepsis or organ failure, and the surgeon's judgment. If the infection is limited and the patient is stable, a surgeon might opt for a procedure that preserves bowel continuity, sometimes with a temporary stoma. But in more complicated or unstable cases, an ostomy like a colostomy from a Hartmann's procedure is often necessary to control infection and promote healing. It's important to remember that each case is unique. Advances in surgical techniques have made it possible to avoid permanent ostomies in many situations. Patients with diverticulitis perforation should be managed by experienced surgeons in a hospital setting. The surgical plan is tailored to the individual's condition, imaging results, and overall health. Always consult with your healthcare team to understand your specific situation, as the approach can vary widely based on individual circumstances.